Imagine living in a city where the water smells like poison. The streets are full of garbage. Dead animals lie in the road. Children are sick. Neighbors are dying, and nobody knows why. Now imagine that the government does nothing. There are no doctors for the poor. There are no clean pipes for water. There is no system to protect people from disease. This was not a nightmare. This was real life for millions of people just 200 years ago. But then something changed. Scientists asked hard questions. Brave leaders made difficult decisions. Ordinary people fought for their health and their lives. This is the story of public health. It is the story of how the modern world learned to protect its people, and how cities went from places of death to places of life. Hi, and welcome to Daily English Origins. Are you learning English? Great! Let's learn English with a very interesting story. Don't forget to subscribe, like, and comment. Let's get started. Every person in the world wants to be healthy. But staying healthy is not just a personal choice. It also depends on the world around you, the water you drink, the air you breathe, and the streets where you walk. This idea is called public health. Public health means protecting the health of all people in a community. Not just one person at a time. It means governments, scientists, and ordinary citizens working together to stop disease before it starts. Public health is one of the greatest achievements in human history. Because of it, people today live much longer than people did 200 years ago. Because of it, diseases that once killed millions are now under control. But this achievement did not come easily. It came through suffering, discovery, and change. The story of public health begins long, long ago. Ancient civilizations already understood that dirty conditions caused sickness. In ancient Rome, engineers built incredible systems called aqueducts. An aqueduct is a large channel, like a bridge, that carries clean water from mountains into a city. Rome also built sewers, underground tunnels to carry waste away from homes and streets. These were engineering miracles. They helped keep the city cleaner and healthier than most places in the ancient world. In ancient India, the cities of Mohenjo-daro and Harappa, built over 4,000 years ago, also had drainage systems. People there understood that waste needed to go away from living areas. In ancient Egypt, religious laws told people to wash their hands and their bodies regularly. These were not just spiritual rules, they were also health rules, even if people did not know that at the time. These early ideas were important, but they were not enough. Disease was still everywhere, and people still did not understand why. When the Roman Empire fell, much of its knowledge disappeared. Great cities became smaller. Aqueducts stopped working. Streets became dirty again. In medieval Europe, the period from about 500 CE to 1400 CE, most people believed disease came from God as punishment. This is called a theological explanation. A theological explanation means an answer based on religion, not science. Because of this belief, many people did not look for practical solutions. They prayed. They confessed their sins. But they did not clean the streets or build better water systems. Then came the greatest disaster in human history. In 1347, a terrible disease arrived in Europe. It was called the Black Death, or the bubonic plague. Bubonic plague is an infection caused by a bacterium, a tiny living organism, carried by fleas on rats. It caused painful swellings on the body, fever, and death. The Black Death killed approximately 1/3 of all people in Europe, nearly 25 million people in just a few years. Entire villages disappeared. Cities lost half their populations. Bodies filled the streets. People were terrified. They did not understand what was happening. But this catastrophe, this terrible disaster, slowly began to change the way people thought about disease. As the Black Death continued, some city leaders began to act. They did not have science, but they used observation, careful watching to make decisions. In 1377, the city of Ragusa, in present-day Croatia, made a historic decision. Any ship arriving at the port had to wait 30 days before passengers could come ashore. Officials wanted to see if travelers were sick. This waiting period was called a Trentino, from the Italian word for 30. Later, in Venice, Italy, the waiting period was extended to 40 days. In Italian, 40 is quaranta. This is where we get the modern word quarantine. A quarantine means keeping sick people, or possibly sick people, away from others to prevent the spread of disease. This was a revolutionary idea. It said, we do not fully understand disease, but we can observe it, and we can create rules to slow it down. Quarantine was one of the first true public health policies. A policy is an official rule or plan made by a government or organization. This policy saved lives, even though the people who made it did not know about bacteria or viruses. For hundreds of years, people believed disease spread through bad air. This idea was called the miasma theory. Miasma means bad air in ancient Greek. According to this theory, rotting plants, dirty water, and garbage produced a poisonous vapor, a gas, that entered the body and caused illness. This theory was wrong, but it was not completely useless. Because of the miasma theory, cities began to clean their streets. They removed garbage. They drained swamps. They improved sewage systems. These actions actually helped reduce disease, even though people were doing them for the wrong reason. This is an interesting lesson from history. Sometimes a wrong idea can lead to the right action. In the 1700s, European cities were growing very fast. This period is called the Industrial Revolution. The Industrial Revolution was a time when factories and machines transformed how people worked and lived. Millions of people moved from the countryside to cities to find jobs. But the cities were not ready. Houses were tiny and crowded. Factories released smoke and chemicals into the air. Rivers became full of human waste. Disease spread everywhere. The poor suffered the most. Working-class families lived 10 people to a room. Children worked in dangerous factories. Drinking water came from the same rivers that carried sewage. Life expectancy, the average age a person could expect to live to, was shockingly low. In some poor neighborhoods in London, children died before the age of 5. In the summer of 1854, a terrible cholera outbreak hit a neighborhood in London called Soho. It kills very quickly. Cholera is a disease that causes severe diarrhea and dehydration, the dangerous loss of water from the body. In just 10 days, more than 500 people died. Panic spread through the streets. A doctor named John Snow decided to investigate. Dr. Snow did not accept the miasma theory. He believed disease had a specific cause. He wanted to find it. So he did something very simple, but very powerful. He walked through the neighborhood and made a map. He marked every house where someone had died of cholera. He talked to survivors. He gathered data, information, and facts. When he looked at his map, he noticed something extraordinary. Almost all of the deaths were clustered around one specific water pump on Broad Street. A pump is a device that pulls water up from underground so people can use it. Snow convinced local officials to remove the handle of the pump, the part you push to get water. Without the handle, people could not use it. The outbreak stopped. Snow proved that cholera spread through contaminated water, water that contained harmful bacteria. He did not yet know about bacteria specifically, but he had found the source. Epidemiology comes from the Greek word epi, upon, plus demos, people, plus logos, study. It means studying what falls upon the people. John Snow is known today as the father of epidemiology. His map was one of the most important documents in the history of medicine. It showed that by collecting data and thinking carefully, we can find the cause of disease and stop it. John Snow's discovery helped change the conversation about public health, but change was slow. Many doctors still believed in miasma. Many politicians did not want to spend money on improvements for the poor. Then, in 1858, something impossible to ignore happened in London. That summer was extremely hot. The River Thames, the main river running through London, was full of human waste. The smell became so horrible that it reached the Houses of Parliament, the building where the British government met. This event was called the Great Stink. Members of Parliament, the politicians who made the laws, could not work. They put wet curtains soaked in chemicals on the windows. But nothing helped. The smell was everywhere. For the first time, the rich and powerful suffered from the same problem as the poor. And because they suffered, they acted. Parliament approved a massive project to build a new sewer system under London. The engineer was a man named Joseph Bazalgette. Bazalgette designed over 1,300 miles of underground brick sewers, tunnels that would carry waste away from the city and into the river far downstream. It took 18 years to build. It was one of the greatest engineering projects of the 19th century. And it worked. Cholera outbreaks in London largely disappeared after the new sewers were complete. Bazalgette's sewers were still in use over 150 years later. He saved more lives than almost any doctor of his century, not by treating sick people, but by preventing sickness from happening in the first place. This was the great lesson of the sanitation movement. Prevention is more powerful than cure. While engineers were building sewers under London, scientists were making an even more revolutionary discovery. They were finding the true cause of disease. For centuries, people believed disease came from bad air, or bad luck, or God's punishment. But in the 1860s and 1870s, two scientists changed everything. The first was a French chemist named Louis Pasteur. Pasteur was studying why wine and beer sometimes went bad. He discovered that tiny living organisms, too small to see with the naked eye, were causing the spoiling. These organisms are called microorganisms or microbes. Micro means very small. Organism means a living thing. Pasteur proposed that these microbes, not bad air, were the true cause of disease. This became known as germ theory. Germ theory states that specific microorganisms, called germs, cause specific diseases. This was a radical idea. A radical idea is one that completely changes the way people think. Many doctors rejected it at first. It was too different from everything they had believed. But Pasteur proved his theory through careful experiments. He also discovered something called pasteurization, a process of heating liquids like milk to kill harmful bacteria. This process saved countless lives and is still used today. Every time you buy a carton of milk at the store, you are benefiting from Louis Pasteur's discovery. At the same time Pasteur was working in France, a German doctor named Robert Koch was making his own discoveries. Koch was a quiet, meticulous man, careful and precise in everything he did. Koch developed new techniques to grow bacteria in a laboratory and study them under a microscope. A microscope is a scientific instrument that makes tiny things look much larger so we can see them. Using these techniques, Koch identified the specific bacteria that caused tuberculosis in 1882. Tuberculosis, or TB, was one of the deadliest diseases in the world at that time. It attacked the lungs and killed millions of people every year. It was called the White Plague. Koch proved which specific bacterium caused TB. The next year, he identified the bacterium that caused cholera, the same disease John Snow had studied in London. Koch also developed a set of logical rules, now called Koch's postulates, for proving that a specific microorganism causes a specific disease. A postulate is a fundamental principle or rule. These rules became the foundation of modern microbiology, the science of studying tiny living organisms. Pasteur and Koch together gave the world germ theory. And germ theory gave doctors a new mission: find the germ, understand it, and destroy it. But even before germ theory was formally proven, one doctor had already found a way to fight disease using the body's own defenses. In 1796, an English doctor named Edward Jenner noticed something interesting. Milkmaids, women who worked with cows, rarely got smallpox. Smallpox was a horrifying disease that covered the body in painful blisters and killed about 30% of those infected. It had killed kings and queens, soldiers and farmers for thousands of years. But milkmaids often got a much milder disease first called cowpox, a similar but far less dangerous disease from cows. After getting cowpox, they seemed protected from smallpox. Jenner had a bold idea. He took material from a cowpox sore and introduced it into the skin of a young boy named James Phipps. Then, in a test that would be considered deeply unethical by modern standards, he exposed the boy to smallpox. The boy did not get sick. Jenner called this process vaccination, from the Latin word vacca, meaning cow. A vaccine is a substance that teaches your immune system, your body's defense system, to recognize and fight a specific disease. At first, many people were afraid of vaccines. Some thought it was dangerous to introduce animal material into a human body. Cartoons in newspapers showed people growing cow heads after vaccination. The public was skeptical. Skeptical means doubtful and not easily convinced. But vaccination worked, and eventually governments began to use it. By the mid-1800s, the evidence was becoming impossible to ignore. Clean water saved lives. Sanitation reduced disease. Vaccination prevented epidemics. An epidemic is when a disease spreads rapidly to a large number of people in a specific area. But none of these things happened automatically. They required organization, money, and power. They required governments. This was a new and sometimes controversial idea. Controversial means that people strongly disagree about it. In the 1800s, many people believed that government should not interfere in personal life or business. This philosophy was called laissez-faire, a French phrase meaning let it be or leave it alone. But disease did not respect individual freedom. A sick person on one street could infect an entire neighborhood. Poor sanitation in one area could contaminate the water supply for thousands of people. Slowly, governments began to accept a new responsibility: protecting the health of their citizens. In Britain, a reformer named Edwin Chadwick published a famous report in 1842 called The Sanitary Condition of the Laboring Population. This report showed with shocking statistics, numbers, and data just how terrible living conditions were for working-class people. It showed that poverty and disease were connected. Chadwick argued that government must act. He helped push through the Public Health Act of 1848 in Britain, one of the first national laws ever passed to protect people's health. It established local health boards and required cities to improve water and sewage systems. Across the Atlantic Ocean, the United States was facing its own public health crisis. American cities were growing explosively in the 19th century. New York, Chicago, and Philadelphia were filling with immigrants. People who had moved from other countries searching for a better life. These immigrants were brave and hard-working, but they arrived in cities that were overcrowded, dirty, and dangerous. Slums, neighborhoods of very poor housing, spread across every major American city. Cholera, typhoid fever, and tuberculosis killed thousands every year. In 1793, a devastating yellow fever epidemic struck Philadelphia, then the capital of the United States. Yellow fever is a disease spread by mosquito bites. It causes fever, jaundice, which turns the skin yellow, and can lead to death. Nearly 5,000 people died that summer. The president, George Washington, fled the city. These disasters forced American leaders to act. In 1798, Congress created the Marine Hospital Service to care for sick sailors. This organization would eventually grow and transform into something much larger. In 1850, a Massachusetts reformer named Lemuel Shattuck published a landmark report recommending a statewide public health system. His ideas were far ahead of their time. He recommended tracking births and deaths, vaccinating children, and inspecting food. Most of his suggestions were ignored at first, but decades later, they became the blueprint for modern American public health. By the late 1800s, it was clear that individual cities and towns could not fight disease alone. Countries needed national organizations dedicated entirely to public health. In the United States, the Marine Hospital Service was reorganized and expanded. In 1902, it was renamed the Public Health and Marine Hospital Service. Then, in 1912, it became simply the United States Public Health Service, an agency of the federal government dedicated to protecting the health of all Americans. In 1906, the U.S. Congress passed the Pure Food and Drug Act. This law was inspired partly by a famous book called The Jungle, written by journalist Upton Sinclair. Sinclair had investigated the meatpacking industry in Chicago, the factories where animals were slaughtered and processed into food. What he found was horrifying: rotten meat, unsanitary conditions, and workers falling into the meat grinders. The public was outraged. Outraged means extremely angry about something that feels morally wrong. The pressure from the public forced Congress to act. The Pure Food and Drug Act required that food and medicine be safe and honestly labeled. It was a revolutionary moment. The government was now officially responsible for the safety of what citizens ate and drank. This led eventually to the creation of the Food and Drug Administration, or FDA, the agency that still regulates food and medicine in the United States today. Just as governments were building new public health systems, the world was hit by the deadliest epidemic in modern history. In 1918, a new and devastating strain of influenza, commonly called the flu, spread around the entire world. A strain is a specific variety of a virus. This particular strain was unusually deadly. It killed not just the elderly and the very young, as flu normally does, but also healthy young adults in the prime of their lives. The disease spread rapidly because of World War I. Millions of soldiers were packed together in trenches and camps. They traveled across continents by ship and train. The virus traveled with them. This epidemic is called the Spanish flu, although it did not actually start in Spain. Spain was one of the few countries that openly reported the disease, so it got the name. In reality, it spread from country to country regardless of borders. The Spanish flu infected an estimated 500 million people, 1/3 of the entire world's population at the time. It killed between 50 and 100 million people. This was more deaths than World War I itself. Cities responded in different ways. Some closed schools, churches, and theaters. Some required people to wear masks in public. Some banned public gatherings. These measures are called non-pharmaceutical interventions, ways of slowing disease that do not rely on medicine. Some cities that acted quickly and decisively had significantly fewer deaths. The Spanish flu was a brutal and heartbreaking lesson. It showed that without coordinated global public health action, a single virus could kill tens of millions of people in months. It also planted a seed. Leaders around the world began to ask, what if nations worked together on public health, the way they sometimes work together on trade or peace? This question would become very important in the decades ahead. After World War II ended in 1945, the nations of the world were exhausted. They had seen what hatred, division, and neglect could do. They wanted to build something better. In 1945, representatives from 50 countries met in San Francisco and created the United Nations, an international organization dedicated to peace, cooperation, and human rights. And within the United Nations, they decided to create a special agency dedicated entirely to health. On April 7, 1948, the World Health Organization, known as the WHO, was officially founded. Its mission was bold and beautiful. The WHO defined health not just as the absence of disease, but as a state of complete physical, mental, and social well-being. This definition was revolutionary. It said that health was not just about avoiding sickness. It was about living a full and dignified human life. The WHO brought countries together to share information, coordinate responses to outbreaks, and set international health standards. It became the command center for global public health, the place where the world's health scientists and leaders worked side by side. One of the WHO's first great missions was to eliminate one of humanity's oldest enemies, smallpox. Smallpox had haunted humanity for at least 3,000 years. It had killed pharaohs and emperors. It had devastated indigenous populations in the Americas when Europeans arrived. In the 20th century alone, it killed an estimated 300 million people. Edward Jenner had given the world a vaccine in 1796. But 170 years later, smallpox was still killing 2 million people every year. In 1967, the WHO launched an ambitious global campaign to eradicate smallpox completely. To eradicate means to completely destroy something so that it no longer exists anywhere in the world. This had never been done before for any disease. The campaign was extraordinary. Health workers traveled to the most remote villages on Earth in Africa, Asia, and South America. They vaccinated millions of people. They tracked every single case of the disease. They used a strategy called ring vaccination, vaccinating everyone who had been near an infected person, creating a protective ring around the disease to stop it from spreading further. It was slow, difficult, and dangerous work, but it worked. On May 8, 1980, the World Health Organization made a historic announcement. Smallpox had been eradicated. It was completely gone from the earth. It was the greatest victory in the history of public health. A disease that had killed billions of people over thousands of years was defeated. Not by an army, but by science, cooperation, and determination. While the smallpox campaign was underway, public health workers were also fighting another ancient enemy, contaminated water. John Snow had shown in 1854 that dirty water spread cholera. But in many parts of the world, access to clean water remained a distant dream well into the 20th century. In the United States, cities began chlorinating their water supplies in the early 1900s. Chlorination means adding a small amount of chlorine, a chemical, to water to kill bacteria. The results were dramatic. Typhoid fever, which spread through contaminated water, nearly disappeared from American cities. Globally, the challenge was much greater. In developing countries, nations that were still building their economies and infrastructure, millions of people still drank water from rivers contaminated with human waste. The result was constant epidemics of cholera, typhoid, and other waterborne diseases. The United Nations declared access to clean water a basic human right in 2010. International organizations, governments, and nonprofits work together to bring clean water systems to rural villages and urban slums. Progress was slow and uneven, but millions of lives were saved. Clean water is perhaps the single most powerful public health intervention in history. When communities get access to clean water, child mortality, the rate of children dying, drops sharply. In the early 1980s, doctors in the United States began noticing something terrifying. Young men, previously healthy, were dying from unusual infections that normally only affected people with severely weakened immune systems. By 1982, scientists had identified the cause, a new virus called HIV, the human immunodeficiency virus. HIV attacks the body's immune system, its ability to fight disease. Without a functioning immune system, the body cannot defend itself against infections that a healthy person would easily survive. The advanced stage of HIV infection is called AIDS, acquired immunodeficiency syndrome. It was a death sentence. The AIDS crisis was also a social crisis. In America and around the world, HIV initially spread most rapidly among gay men. Because of prejudice and stigma, negative social judgments, many governments were slow to respond. Activists, passionate people who fight publicly for change, demanded action. Organizations like ACT UP marched, protested, and confronted politicians and pharmaceutical companies. They demanded faster research, faster drug approvals, and more funding. Their courage worked. By the mid-1990s, scientists developed antiretroviral therapy, powerful medications that could control HIV and prevent it from progressing to AIDS. People with HIV could now live long, healthy lives. The AIDS crisis taught the world that public health is inseparable from human rights. You cannot protect health if you ignore discrimination. You cannot fight disease if you refuse to protect all people equally. In December 2019, a new and unknown virus began spreading in the city of Wuhan, China. Within weeks, it had spread to dozens of countries. By March 2020, the World Health Organization declared a pandemic. The virus was called COVID-19, Coronavirus Disease 2019. It spread through the air, especially in enclosed spaces. It caused severe respiratory illness, difficulty breathing, in many patients, and it killed millions of people worldwide. The world's response was extraordinary, though deeply uneven. Scientists used decades of accumulated knowledge. Pasteur's germ theory, Koch's laboratory methods, Jenner's vaccination concept, to develop safe and effective vaccines in less than 1 year. Normally, vaccines take 10 to 15 years to develop. The COVID-19 vaccines were developed in under 12 months. Using a revolutionary new technology called mRNA, messenger RNA, that teaches the body's own cells to recognize and fight the virus. But the pandemic also exposed painful weaknesses. Misinformation, false information spread rapidly, especially on social media. Trust in public health institutions declined in some countries. Inequalities in healthcare meant that poor communities and developing nations suffered far more than wealthy ones. COVID-19 was a reminder, a powerful and tragic one, that the work of public health is never finished. Every generation faces new challenges. Every generation must recommit to the values of science, cooperation, and care for all people. 200 years ago, a child born in a city could expect to live perhaps 35 or 40 years. Disease was everywhere. Clean water was rare. Governments felt no responsibility for the health of their citizens. Today, global life expectancy is over 70 years. Smallpox is gone. Polio is nearly eradicated. Cholera outbreaks, while still occurring, are far more controlled. Millions of children who would have died from measles or tuberculosis are alive because of vaccines and modern medicine. This transformation did not happen because of one person or one discovery. It happened because of thousands of people. Scientists, engineers, doctors, activists, politicians, and ordinary citizens who believed that human life had value. That the health of the poorest person mattered as much as the health of the richest. John Snow drew a map and stopped the cholera outbreak with a single water pump handle. Joseph Bazalgette built tunnels underground and saved a city. Louis Pasteur looked at microbes in a laboratory and changed medicine forever. Millions of health workers traveled to remote villages and vaccinated children against smallpox, until there was not one case left on earth. Each of these people understood one profound truth: we are only as healthy as our community. A disease that touches one person can reach millions. But a discovery that helps one community can save the world. Public health is at its heart a story about human beings choosing to take care of each other. Not just family, not just neighbors, but strangers, people across cities, across nations, across continents. That choice, that fundamental human commitment is the greatest medicine of all.